Okay, we're going to do some trach care to Mrs. Smith here. I went ahead and knocked on the door, introduced myself, explained to Mrs. Smith that we're going to go ahead and do some trach care. So before that, I made sure I had all my supplies coming in. I have a trach cleaning care kit, suctioning kit. Suction is set up in the room, and then I have all the PPE that I need. Face mask, goggles, so you can get a lot of splatter up. So first thing I'm going to go ahead and do is hyperoxygenate Mrs. Smith. Like we did in the previous videos, we did some, the first part of this step of trach care is sterile suctioning. So we're going to go ahead and do the sterile suctioning kit. I would make sure suction is set up, -120, -150, open up the kit, put on my gloves, having a clean hand and a sterile hand. I could administer some lube to my sterile hand, and then after hyperoxygenating her, I'm going to go ahead and the catheter, and I'm going to insert, and we're just going to suction her out real quick. We'll go ahead and insert the tube till we feel a little resistance, pull back a little bit, and go ahead and suction out. Now we'll talk to Mrs. Smith while we're doing this, just to make sure she's feeling okay. We can go ahead and give her some more oxygen after we suction. So now we're going to do trach care. So this is an aseptic technique. We'll go ahead and lay this down. Meanwhile, I am monitoring all her vitals. I'm going to go ahead and check the cuff pressure, make sure it's in between 20 and 30. We'll open up this here and lay out, we'll utilize our table, lay out the gauze, and we're going to go ahead and take out her inner cannula. I'm going to hold on to the flange itself here so it does not come out. And if it's a disposable one, we could go ahead and get rid of it. If not, there's stuff in our cleaning kit here. There's saline. We can go ahead and wash it out. Little pipettes, air dry while we are cleaning the stoma site. So now what we have here are some Q-tips, and I do have a sterile saline. The Q-tips are in plastic, so they're already sterile. And I'll go ahead and insert some saline into there. So what we want to make sure, I will untie the securings around it. Let's go ahead and take off her old gauze as well. We'll get rid of that in the new kit. There is a new gauze. We'll go ahead and from the inner part here, from the inner part outward, and then dispose of the Q-tip. Inner part outward, dispose of the Q-tip. I'm going to continue doing this, cleaning around the stoma. We need to make sure that the skin check of the stoma, making sure that it's not red or irritated in any way. Meanwhile, always monitoring my patient. She's breathing okay. I do have a resuscitation bag in here if she was having some complications while we're doing this. So now I went ahead and did one side, the other side. I can get dry, get my new gauze, put it in there, and get a new tie and tie the trach properly. I can go ahead and insert my trach inserted. And I want to make sure that my patient is comfortable. If there was anything along the way that I saw that was abnormal, I would definitely right away report to the nurse, doctor, and document myself. And we'll go ahead and clean up everything, sit Mrs. Smith back up. Mrs. Smith, are you comfortable? You need anything? And make sure she has her call light and make sure she's breathing well. Vitals look good, and cuff pressure maintained in between 20 and 30.